because it is only by knowing where the virus is that appropriate interventions can be deployed. I'm delighted to note that as a country, we have made significant progress in the fight against the virus, a situation that has contributed to the de-escalation of restrictions and opening up of the country. However, as articulated by His Excellency President Uhuru Kenyatta early this week, the opening of the country does not in any way suggest that we have now contained the spread of the virus, and that is exactly what the governor has also told us today, and which is a fact, that we did not open up because we have defeated the virus. We opened up because we believe that the citizens of this nation, if they work with us and follow the rules, regulations, as we have explained from the Ministry of Health, from the county governments, from the national government, then we are ready to tackle it all together. Considering that the country has been on a semi-lockdown for several months, the easing of restrictions was necessary to allow for other economic activities to be restarted. However, this also shifted the responsibility of complying with the containment measures to individuals. And I want to thank you, Governor Kingi, because you have emphasized on this matter from the word go, from when it started. And if I were to, at the risk of embarrassing Governor Kingi, to say that he is one of the first people to call me on this issue of the virus, and one of the first people to actually go on self-quarantine himself in the country. And Governor Kingi, I think at some point you want to tell people how self-quarantine was, so that we don't quarantine people in hospitals, we quarantine them at home. But, as you yourself have said, sisi wananchi tuna yetu. As earlier stated, every one of us must play a significant role if we are to stop the spread of this disease in our communities. The motivation to play such a role should be an inner drive within every individual, without expecting the government to force you to do so, without expecting the government to enforce compliance. If other societies have done it, there is no reason why we in Kenya cannot do it. To achieve the level of readiness to handle possible upsurge in coronavirus infections, the counties have invested lots of efforts to establish fully equipped and dedicated COVID-19 facilities. I am very happy, Governor Kingi, to note that the county government of Kilifi has so far made available an isolation facility, and not just this one, but the many that you have mentioned, with over 318 beds, meeting and surpassing the presidential proposal that was made about the 300-bed facilities. The county has further availed 7 ICU beds and 7 ventilators. And Governor Kingi, I would like you to know that at your request, and if you need more, the national government will support your ICU facility, including more ventilators as needed. I also want to take this opportunity to congratulate you on this fantastic complex that has been put up from scratch, from zero, to what we can see here today. And honestly, it is one of the ways of establishing and symbolizing the success of the system of devolution in our nation today. Your leadership in this matter of healthcare has been noteworthy, and I want to congratulate you and your government for the good work you continue to do in the healthcare system. Other interventions include the hiring of healthcare workers to boost the human resource capacity. I'm informed that 138 healthcare workers have been recruited under the Universal Health Care Program, and a further 89 are in the process of being recruited. Under the Management Equipment Services, MES program, the ministry has equipped the Kilifi County Referral Hospital with renal, radiology, and theater equipment, which are now offering benefits to residents and saving them from traveling for specialized treatment out of this county and indeed country. As we ramp up our capacity to handle COVID-19 patients, I want to urge Kilifi residents to continue adhering the call by the governor and the national government to adhere to the containment measures advocated by the Ministry of Health. The measures can only be effective if all of us take the necessary precaution to protect ourselves and those around us. We must continue to observe physical distance, wash our hands, use sanitizers where appropriate, and wear a face mask when in public places. Apart from the problem of COVID-19 disease in the country, there are other diseases, not just in Kilifi, but elsewhere, but around the nation. Kilifi County, for example, is grappling with other communicable and non-communicable diseases such as high blood pressure, diabetes, chronic respiratory tract conditions, among other underlying conditions. And it is important for us to appreciate that during this COVID-19 period, people suffering from these diseases are more vulnerable to contracting the virus and are therefore advised to take extra precaution. In case you have not noticed, as we announce the causes of death via COVID-19, you will have noticed that diabetes is probably the highest in terms of persons who are passed on with underlying issues. Fellow Kenyans, in the last few weeks, we have noticed that our cases are steadily growing, and the number of counties that have so far recorded COVID-19 cases stand at 42. Kilifi County is one of the counties, obviously, that has reported cases. In terms of the caseload per county, Nairobi leads with 5,188 people infected, followed by Mombasa at 1,720. Kilifi stands at number 10 with 71 infections and 45 discharges. However, with the opening of the country, we must acknowledge that this state of affairs can change, and the number of infections are likely to increase. Therefore, to keep the number of infections down here in Kilifi, we should not let our guard down, and we must continue to strictly observe the containment measures. And I congratulate the government of Kilifi for ensuring and pursuing these measures relentlessly. Today, our numbers of those who have tested positive have continued to rise above what we recorded yesterday. Out of a sample of 6,979, nearly 7,000, a total of 473 people have tested positive to coronavirus disease just in the last 24 hours. This takes our caseload to 9,448 for the positive cases from a sample of 2,006,584. From today's positive cases, Kilifi County has 3 more, bringing the county level caseload to 71. In terms of gender, once again, 324 are male, while 100 and 49 are female. The youngest is 1-year-old infant, while the oldest is 90 years old. And we continue to face this situation where our men, we men, are being affected by this virus a lot more than women. And we must continue to ask ourselves why this is the case. And perhaps it has something to do with the behavior patterns that the governor was alluding to earlier. We are more likely to go into certain places such as crowded areas, some of which will remain nameless, but nonetheless we know them. Jana tulikuwa tunazungumza mambo ya miraa, tunajua vile hiyo mambo inaendelea, tunakaa pamoja, kukaribiana sana. Mnajua kukaribia mtu is not keeping social distance. So I'm appealing also to our fellow men that when you get sick, you are likely to take it home with you. You are likely to infect the children, perhaps the family members in that home, and therefore I urge you to desist. No matter how tempted you get to go to a little crowded place, hesitate. Think about the wife, think about the family, think about your friends, and you do not enter that place. On a positive note though, today 76 patients have been discharged from various hospitals, bringing our total recoveries to 2,733. Here in Kilifi, we have had 4 patients who were previously on home-based care program and are now recovered from the disease. We continue to appreciate the good work of our health workers in saving lives. Unfortunately, today we have also lost 8 patients to the disease, bringing the cumulative number of fatalities to 181. I want to express my deepest condolences to the families and friends of those who lost their lives, obviously including our colleague in the medical field. As I conclude, I want to thank you all for granting the team the privilege of being here, and to thank you for the privilege of addressing you, and to express my gratitude to our healthcare workers. They have been outstanding on their commitment to duty, and their dedication has brought us good results. I want to urge them to continue offering such selfless service to our people. Finally, let me thank the county government of Kilifi, not only for uplifting the level of readiness, but also in mobilizing the people to embrace the containment measures. The gains so far made through the cooperation of the national and county government people. I want to urge you to keep walking this path, and certainly, if it happens that way, if we continue with the same spirit, we will defeat this disease. We will not go the same way as we have noticed in other parts of the world. We will come out better. We will come out stronger. Yes, this is a COVID-19 facility right now. The governor is working hard to do whatever he can in here, to put the ventilators, to put the beds, to put everything else, but those things will not go with COVID-19. So post-COVID-19, we will have a fantastic healthcare Governor Kingi. As I conclude, I also want to say, Governor, that we did not come empty-handed because of, as you know, we have been supplying items as you request and as they become available. So even today, we have come with us with some 50,000 protective gloves for your healthcare workers. We have also brought you some 8,750 shoe covers, N95 masks, about 500 of them, and the regular mask about 1,200, plus 50 coveralls and now 125 goggles to go with them. So I want to thank you very much, and maybe now we can take one or two questions.
Thank you, Mheshimiwa Waziri, Mheshimiwa Governor. Na waandishi wa habari, ndio muda wenu kuuliza maswali. Naomba unapopata muda wa kuuliza swali sema jina na kitu ambacho unawakilisha. Na yawe mafupi. Kimtai.
Thank you. My name is Kevin Mutai from NTV. Waziri, my first question comes to you. There's a controversy, reports of a controversy surrounding the transfer of some of the staff within the ministry. Maybe you can shed more light on that. And then again, my second question goes to Dr. Amoth. Yesterday you said that 90% of the infected cases in the country are asymptomatic. So are we likely seeing a possibility of that a majority of Kenyans confirmed positive for COVID-19 are likely to experience symptoms like a normal flu with this strain of the virus? Thank you.
My name is Tobias Chanje from KTA News. My first question, may I kindly know the total number of health workers who have been infected? Then my second question, there's been a concern from other cadres working the health facilities. These include telephone operators, cashiers, and hospitality personnel who've been complaining that they are able to get their allowances. This is extraneous allowances and also the COVID-19 allowances. What is their fate?
Kwa Governor Kingi, tumeona maambukizi yameanza kujiregea katika kaunti hii. Sababu ni zipi? Wakazi wanalegeza kamba wanakuaje? Alafu swali langu la pili kwa waziri, that's to do with the COVID-19 vaccine. We understand that the trials are set to begin in the next few weeks. Focus is Kilifi County and Mombasa County. Talk to us about the safety of this COVID-19 vaccine, and also it has been tested in the UK and the US, and we understand that it's going to include some 40 health workers in the first phase. Can you touch on that so that we can be able to have an update?
My name is Michael Mondiga from Kenya Broadcasting Corporation. My question is, Kenya is known as a land of innovations, and I would like to ask our local researchers, are they working on any drug at the moment to fight the virus? Thank you.
Thank you very much. Let me start with the last one and then work backwards, and then I'll give opportunity to Governor Kingi to respond to his specific questions. On the issue of innovation, I want to report that today I paid a visit to the KEMRI research station that is here with us. And I want first to congratulate the team that is working here in Kilifi, in Welcome Kilifi. Welcome KEMRI, KEMRI Welcome Kilifi, because they are doing a fantastic job. It is my first time in that facility. I was totally impressed. It's a world-class facility with world-class brains, world-class minds, and it actually puts us to shame when sometimes we are looking for people to come from UK or South Africa or some other places like that, because we kind of don't understand, and we don't take note, and we don't appreciate our own. We really don't. That's what I have seen today. We don't need to consult wazungus kutoka mbali. Wazungu wetu wako hapa KEMRI na wanangozi kama hii yangu. That's who they are, and they are doing a fantastic job. So in terms of innovation and research, they have come out with fantastic ideas. And by the way, I want to inform you that part of the decisions that the Kenya government makes in regards to COVID-19 is informed by some of the research and modeling that is done in this institution here in Kilifi, as well as the others. And indeed, if a vaccine is going to be found, it is probably going to be found right here in Kilifi. As for the testing that you are talking about, when there is indeed such a test that is going to start, we will make it very clear There will be proper announcements regarding the procedures and who is doing what, and who is collecting what samples, and who is proceeding with which issues. But at the height of all those things, safety will obviously be the paramount consideration for us. And we would never use individuals as guinea pigs, to test something that we are not sure about. And the doctors and the researchers who are in this institution will tell you that themselves. And in fact, I was very impressed to see some of the work that is going on there involves the creation of a vaccine. And we have got some very smart people there who we hope are going to come up with one soon. And if they do, one of the other things to make sure, and this one is to the KEMRI executives and board, is to make sure that our intellectual property rights stay here in Kenya, that our young men and women do not spend their time, their brains, just to have that vaccine registered by somebody else and then sold to us, as if we are recipients instead of the innovators and creators. So, yes indeed. So I would like to urge Dr. Kombe that, and he is here with us, Dr. Kombe is here, he's the CEO of KEMRI, just to ensure that indeed we do not want our intellectual property to be taken away from us via one disguise or another. On the issue of the operators in hospitals, whether they be cashiers, I thought you are going to talk about their safety, but you are talking about the allowances, which are equally important. And because I don't know whether you're talking about the ones in KEMRI, because those ones are taken care of by Kombe, or you're talking about the ones in the Ministry of Health Nairobi, which we are taking care of, or the ones in the county government, which Governor is taking care of. As for the issue of transfer, that's normal. You work for KTN Mombasa. You can be, or you work for NTV. Mutai, you work for NTV here. You can be transferred to NTV Kisumu or NTV Nanyuki. Move on. So please, Governor.
Asante sana Waziri. Fikiri swali langu ni moja tu kutoka kwa Mtalaki, kwamba hivi majuzi tumeanza kuona visa vya corona vikizidi katika himaya hii ya Kilifi. Idadi kupanda imechangiwa na vitu viwili. Mwanzo ni ukaidi wa kanuni na masharti ambayo tumepatiwa. Unakumbuka kwamba kabla hivi majuzi ambapo rais alifungua mipaka na watu wakaanza kupata uhuru wa kutembea, ilikuwa kwamba mtu kutoka Kilifi kuingia Mombasa, ama kutoka Mombasa kuingia Kilifi, ama kutoka kaunti zingine kuingia hapa, ilikuwa imepigwa marufuku. Lakini kwa sababu ya ukaidi wa watu fulani, kuna wengine walikimbia Mombasa kupitia Mazeras, wakapanda bodaboda wakaingia Kaloleni, na baada ya kuandamana nao tulipowashika, wengine walipatikana wana corona na wakaambukiza familia zao. Tunakisa wakati ule ule tulijua wazi ilikuwa vizuiza vijaondolewa. Kuna mgeni kutoka Tanzania, Tanga, alikuja mtembelea jamaa yake hapa Kilifi, na vipi alipitia vizuizi hivyo vote, na tulipomweka katika quarantine hapa KMTC, baadaye tulipompima akapatikana na corona, na pia yule jamaa yake akapatikana na corona. Kwa hivyo utakuta kwamba vile visa vya awamu ya pili vilichangiwa pakubwa na ukaidi wa masharti ambayo tulikuwa tumeweka. Kwa hivyo ukaidi wa masharti pia umechangia pakubwa katika kuzidisha ile idadi ambayo tunaiona ya maambukizi katika jimbo letu. Sababu ya pili ni kwa nini pengine tunaona idadi hii inazidi, ni kwa sababu tumeanza kupima watu wengi. Zamani ilikuwa kupata vipimo, vile vifaa vya kupima ilikuwa ni vichache, lakini nataka nimshukuru waziri, manake kwa sasa vile vifaa ambavyo tunahitaji ili kupima wananchi sasa vimeanza kuletwa kwa wingi, na kadri unavyopima watu wengi ndivyo unapata idadi ya wanaokuwa na virusi pia nao inapanda. Kwa hivyo sababu ni hizo mbili ambazo zimechangia pengine kuona kwamba ile idadi ya wananchi wanaopata virusi hivi katika jimbo letu la Kilifi limepanda. Ndio maana nimesisitiza kwamba kupunguza idadi hii ya waambukizaji ama kuongezeka kwa idadi hii ya waambukizaji iko mikononi mwetu kama Wakenya. Tunaweza kuifanya iwe chache idadi hii, ama tunaweza kuifanya iwe nyingi idadi hii, iwapo tutazingatia kanuni hizi na kuzitekeleza. Ama tukikaidi, bila shaka idadi hii itaendelea kupanda kila uchao. Asante.
Thank you, Waziri. Thank you, Governor. My question was regarding the percentage of asymptomatic. Yes, correctly stated at 90% as of today, and about 10% of our people get mild, moderate, and critical disease. And this could be attributed to our demographic profile, because if you look at the profile of the African population, we have close to 60 to 65% of the population being young people under the age of 25 years, and therefore they tend to get a mild form of the disease. Looking at the statistics for today, we have 44 people in ICU, and 22 out of the 44 are on ventilator support, and 22 others are on supplemental oxygen treatment. This tells you that, therefore, it is imperative that we develop strategies to ensure that we can be able to manage some of these people at home. Based on the WHO criteria of home-based care, we, together with our case management team, customize the protocols from WHO to suit our local environment. And now we are managing quite a number of people at home, because majority of our people are still asymptomatic, based on agreed criteria that has to be met and be verified by the healthcare workers. And also because majority of our people are asymptomatic, that has accounted also for a low mortality rate in our population, which as of today stands at about 1.9% compared to the global average of 6.7%. So going forward, we are going to put more emphasis on home-based care. That is why I've developed those guidelines and even translated them into Kiswahili. And we appeal to other counties to be able to develop abridged versions of the home-based care protocols in local dialect, so that the people can be able to own them, because responsibility for management of COVID disease going forward rests with the individual. And it's also imperative that we look at the cost of management of asymptomatic to the very critically ill. The cost of management of somebody who tests positive for COVID, who is basically asymptomatic per day, is about 21,300 Kenya shillings. If you have a mild form of the disease with mild symptoms, maybe a mild cough or just slight difficulty in breathing, then that puts you at 21,400 shillings per day. If you have a severe form of COVID, in which case you require supplemental oxygen, that figure jumps to 51,000 shillings per day. And if you require ICU critical care support, including intubation and ventilator support, the figure goes to 71,000 per day. So looking at these economics, then it makes business sense to be able to put measures in place to ensure that we practice home-based care, especially that a big proportion of our population get a mild form of the disease. And we pray going forward, as the disease evolves, that the same scenario obtains. Question 2 was on the number of healthcare workers who have been affected or infected by COVID-19. That, as of today, stands at 292, 160 being females. And this is where now the figures change a bit, and about 132 being male. Reason being, most of the people who take care of the COVID-positive cases in the isolation centers are nurses, and majority of our nurses are female. So that explains that change in the ratio. And of course, today, as Waziri has said, we have reported the first death of a healthcare worker. The rest of the people, healthcare workers who are under care are doing well, and we hope and pray that they shall make full recovery. Thank you.
I also want to take this opportunity to also wish those people, the 4 people the governor mentioned, who are behind us in this building, if they can hear us, I want to wish them well. I want to wish them quick recovery, and I want to tell them that the nation is with them, and we are all together in this fight, and they will recover. In God's name, they will recover. Thank you very much indeed. Was there maybe one more?
Ile swala ambalo wale wahudumu wanahudumu katika hizi quarantine center ama isolation center, ikiwemo wale subordinate staff ambao huenda kuishia wakipata virusi vya corona, je, hali yao ya fidia iko vipi? Wale wafanyikazi ambao si nurse wala si wauguzi, lakini huenda wanaishia kupata virusi vya corona, ikiwemo katika kaunti ya Kilifi hapa, ambao tunasikia huenda mmoja wapo walipata virusi hivyo. Je, fidia yao iko vipi? Watalipwa ama ni vipi? Ya pili ni mikakati gani mmeweza kuiweka kuweza kuhakikisha iwapo makanisa basi yatafungua milango yake hivi karibuni, ile idadi ya watu 100 na wale ambao hawaugui virusi hivi, hawaugui virusi ama magonjwa mengine ambayo ni hatari, huenda wakashughulikiwa, wakazuiliwa kutoingia katika kanisa. Idadi ya watu 100 na wale wanaougua magonjwa mbalimbali ambayo ni hatari watazuiliwa vipi kuingia kwa makanisa? Na la mwisho kabisa, kaunti ya Kilifi, kisa cha kwanza kilitokezea na gavana wa kaunti na naibu gavana wa kaunti ya Kilifi Bwana Saburi, ambaye kisa kwanza kiliweza kushuhudiwa katika kaunti ya Kilifi. Hadi kufikia sasa bado kuna hatihati. Kuna wale wakazi ambao wanasema hakuwa na virusi, wengine wanasema alikuwa navyo. Umefika hapa leo, Pasua Mbarika, tuambie hali halisi ilikuwa vipi ya naibu gavana huyo? Asante.
Mwisho tafadhali.
Earlier on, Waziri, when we began the fight against COVID-19, there were issues concerning the truck drivers. And my question now goes to the governor. What are some of the measures that have been kept in place in order to curb COVID-19 to the truck drivers, especially in Magarini sub-county, where truck drivers are mingling even with the residents? Thank you.
Kuhusu mambo ya makanisa, sio tu makanisa, ni misikiti na kwingineko, there are protocols. Tuna protocols zile ambazo wenyewe, there is the community that came together, committee that came together between the spiritual leadership in our nation, and between them and the Ministry of Health, we have developed protocols that are going to be used in those institutions as they go for their prayers. So they themselves have announced those protocols. They themselves are supposed to observe those protocols and ensure that the protocols are followed. Kwa hivyo mambo ya kuzingatia, hiyo mambo ni ya wenyewe. Wale wahubiri wako hizo kanisa ni lazima wenyewe washunge na waangalie na wajue ya kwamba hakuna watu ambao wana ugonjwa wataingia au makanisa, kwa sababu wakiingia huko makanisa, sana sana ukiwa na diabetes na uwe vile vile uko na miaka ya kutoka 60 kwenda juu na uko na diabetes, afadhali uombee nyumbani. Afadhali uombee nyumbani, kwa sababu Mungu atakusikia. Hata ukiwa nyumbani, hata ukiwa, Mungu yuko kila pahali. Hiyo ndio Biblia inatuambia hivyo, Qur'an tukufu inatuambia hivyo vile vile. Kwa hivyo hata ukiomba ukiwa nyumbani ni sawa kwa wakati huu. Alafu hapo mbeleni kidogo hii virusi ikienda, tutarudi huko na tutaomba na tutakuwa hapa. Hakuna haja ya kukimbia. Uingie kanisa. Wewe ni wa miaka 65 ama 62 kama mimi, unaingia kanisa, uko na diabetes, uko na high blood pressure, alafu wewe unajua hiyo direction vile tutaenda, na hakuna haraka ya kurudi huko, na hakuna haraka ya kwenda mbinguni. Kwa hivyo ni afadhali tufuate masharti na kanuni zile zimewekwa na makanisa wenyewe na misikiti yenyewe. Kuhusu mambo hiyo ingine, kuna mtu mwingine niliulizwa niseme juu yake, lakini sikubuki. Ulisema nani? Unaweza kuuliza swali na mimi nitakwambia pia sikubuki. Sasa tutaenda mpaka wapi? Tafadhali Governor, endelea, kwa sababu hiyo ni maneno iko katika makoti, kwa hivyo siwezi kuzungumza mambo ya makoti, lakini ukiuliza tena pia sikubuki. Endelea.
Asante waziri. Nafikiri swali ambalo nilikuwa nimeulizwa ni harakati gani ama ni mipango gani ambayo tumeiweka kabambe hususan kuzuia uambukizaji wa virusi hivi kutoka kwa madereva malori ambao wanaingia katika kaunti ya Kilifi, hususan katika sehemu ya ukanda wa chumvi kule Magarini. Kabla vizuizi kuondolewa, katika kila mlango wa kuingia kaunti yetu tulikuwa na polisi pale, na pia tulikuwa na timu ya wafanyikazi wa afya ambao walikuwa wanahakikisha kwamba wamechukua viwango vya temperature na dalili zingine kabla mtu kuingia katika himaya yetu. Lakini baada ya vizuizi hivi kuondolewa, baada ya rais kuzungumza, ni kwamba sasa zile roadblocks zimeondolewa, na pia wale wafanyikazi wetu nikapata taarifa nao pia walifunga virago na wakarudi katika hospitali yao. Lakini hilo swala tumelizungumzia kama kamati ya juu inayopambana na COVID hapa Kilifi, na ni kwamba japokuwa hakutakuwa na kizuizi cha mtu kuingia hapa Kilifi, lakini hutaruhusiwa kuingia hapa Kilifi mpaka wale wahudumu wa afya ambao tutawaregesha katika milango yetu wathibitishe kwamba huna dalili vinavyoashiria kwamba pengine una virusi hivi, ndipo tutaruhusiwa kuingia. Na hili halitakuwa tu kwa madereva malori, lakini kwa mtu yoyote yule ambaye anataka kuingia katika jimbo la Kilifi. Asante.
Thank you very much indeed.
This Monday,